the 33 million, 2.1 million are dying. And this is despite the presence of antiretroviral drugs that would keep a person healthy and alive and well. But there are issues and then breaks that we will discuss in one of the next lectures. But to know that 2.5 million infections occur every year and about 2 million, 2.1 million people dying, these are estimates. Of course, these are not the real head counts, but they are more or less closer to reality. It's important to know that despite the amount of knowledge and amount of things that we are talking about, we still have this epidemic that is dynamic. It's moving. An example that happened in the country that always boasts of the best public health is the United States has got a root shock last year, 2008, that in the whole of United States, because of the massive information and massive literacy rates of that country, the new infections in the U.S. had fallen to about 29,000 cases in the whole year in the entire 300 million population of the United States. But in 2008, they realized that because they had kind of gone complacent, they thought that everything was happening, only 30,000 new infections a year. In 2008, they got a head count of new infections occurring as 55,000, which means there is about 90% increase in new occurrence of new cases or new infections in the U.S. Now, this slide that is now on your vision is just trying to show you a curve from 1990 to 2007, how the 33 million people have eventually kind of accumulated. But I have added a small line at the back, on the bottom of it, and says that in 1986, WHO in Geneva convened the first meeting on HIV. Fortunately, I was part of that. And we first estimated a global number of infections of HIV as being 10,000. There was an estimation in 1986 that there are 10,000 people who are infected with HIV globally. And that was, of course, because very, very little was known, and whatever was known was the estimate based on that. But something that could have been contained, if it was that easy that a sexual epidemic can be contained, then we wouldn't have been looking at 33 million infected people. Now, with almost now 2.1 million dying almost every year. So that's a very large number. In Asia, our own subcontinent or a group of countries in Asia, the number of infections at the moment is about 4 million. So out of 33 million, the Asian region has 4 million people living with HIV and AIDS at this point. Predominantly then, where is the most of the infection? I think some of these slides are saying almost the same thing, so we will just move on. And these are again talking of deaths. We just talked about 2 million deaths a year. I think this figure will remain with you for a while. But if there are only 4 million people with HIV-AIDS in Asia, the real bulk is in sub-Saharan Africa. We are not talking of whole of Africa. There is a Sahara Desert that goes across the heart of Africa, and amongst the 54 countries of Africa, half of them are below the Sahara belt, and that's where you have 22.5, almost like 85% of the load of HIV/AIDS is in sub-Saharan Africa. There was a point in time 10 years ago that countries like Botswana and South Africa, Botswana, Lesotho, and South Africa, the prevalence of HIV reached 35% amongst adults, which means that 1 out of every 3 people sitting anywhere were HIV infected. And that of course has kind of receded a little bit, not because it's not curable, so couldn't have been cured anyway. The question is, it receded because a lot of infected people actually died because the antiretroviral drugs were not available and not actually discovered by then, and now that people are able to live longer, at the same time the newer infections have declined, but the adult prevalence in sub-Saharan Africa across the board is now at 5%, and while in South and Southeast Asia it's 0.3%. I know Indonesia is at 0.2% of the adult population. East Asia is at 0.1, so that's where Philippines is. Been very fortunate all along, despite the number of sex workers in Manila. And Eastern Europe and Central Asia is 0.9. India is at 0.9% too. A big country, 1.1 billion people with 0.9% of seroprevalence. Good. I think you will remember some of those figures. I have not shown you Americas and Latin America because that would kind of add up more of zeros in our minds, so we don't want to forget the messages. But there are models how the sexual transmission has been kind of contained in sex workers in Kenya, and this model actually drove the world's major interventions. We will touch this in one of the next lectures, but I just wanted to make a point, and the point is that when we talk about cofactors like sexually transmitted infections, or we talk about barrier preventive measures like condoms, these, if they are done individually, they do not work as well, and this is where you have an example, that if there are no